One of the effective treatment options available for older women is that of embryo pooling. The big problem with older women, of course, is as they get older, their ovarian reserve or egg quality declines. The antral follicle count goes down, their AMH levels go down, and they don't produce too many eggs after superovulation, and often these eggs aren't good quality, so they didn't get enough embryos, as a result of which their eggs are very precious and their embryos are worth their weight in gold. So that rather than do sequential IVF cycles for these women, because if they do an IVF cycle, do a transfer, don't get pregnant, that means they have to wait and take a break. One option is called embryo pooling, which means you do 3 fresh IVF cycles back to back, but don't transfer any embryos at all, but freeze all these embryos at a blastocyst stage so that you're buying time, and then you can transfer these frozen blastocysts after thawing them later on. The truth is that a bird in the hand is worth two in the bush, and because the fertilization rates in these women aren't very great, it's really important to convert those eggs into embryos as quickly as possible. And because the success rates with embryo freezing are so good because we use vitrification, this allows them to maximize their chance of getting pregnant. And if they have 3 or more frozen embryos and do get pregnant with their first transfer of a frozen embryo, they can still keep the additional frozen embryos for the next baby. So they can have their cake and eat it too. So this is an option you should explore with your doctor if you have poor ovarian reserve.